Hi, I'm Dr. Patrick Foy, and I am a professor at Rutgers, New Jersey Medical School, where I am the director of the Coccyx Pain Center, or Tailbone Pain Center. And this is just going to be a short video on reviewing an MRI for a patient with tailbone pain. This was an MRI from a long time ago, so not a recent patient. We're going to look through how do you evaluate an MRI, what do you look for, and where do we go from there. So first of all, nowadays typically the MRI will be on a computer CD. The images will be on there. I've already loaded them in, so I'm going to switch this around so we can get a look at this. Okay, so and that's me, Dr. Foy. All right, so first thing you'll see on the left of the screen, usually when you load, MRIs can have hundreds and hundreds of images in a different series, and it's almost like it's taking a whole bunch of different slices through the body, one slice after the other, just like you could slice a block of cheese up on the delicatessen slicer. So the images that are usually most helpful are the sagittal images for the tailbone. There's others that are important too, but we're going to look at some of the sagittal images here. So I'm going to double click on it. It's going to display here, and then I'm going to scroll through. So basically, using my mouse, I'm going to scroll on through the images, or you could use some of the the play button there, to go through one after the other as well. But I'm just going to scroll through one at a time. And basically, in scrolling through, I'm looking to get to the point where we're right at the midline. So now you can see the sacrum coming into view, and then down below that is the coccyx or tailbone. Just to give you some orientation, I'm going to swing back again and show you here. This is a model of the lower back, sacrum, and coccyx here. In this case, the tailbone is a little bit dangling on this model after years of educational use. But basically, if you look from the side, you'll basically see the sacrum and coccyx. And now I'm going to switch back again here. Just for comparison, the sacrum, and then down here is the coccyx or tailbone. So sort of, just to give you the corollary, it's sort of like that. But the image isn't quite so clear yet. So one of the things that I'm going to do is to come up here. If you can see the cursor on the screen here, and I'm going to come up to this little one, which is called the gray level. And if I click that button and come over here to the image, and now using my mouse, I can press down and drag the mouse up and down. And as I do that, you can see the brightness on the screen is going up and down. And as I drag my mouse left and right, the contrast on the screen is getting more and less. So here you can start to see the image come into a much clearer appearance right here. And the next thing I do is typically count the sacral segments, and usually there are 5 sacral segments. So looking here at sacral bone number 1, 2, 3, 4, and 5. And then that makes this dark line, the joint space here between the sacrum and coccyx, which makes this bone number 1 of the coccyx. And then here is the rest of the coccyx. In this case, actually, bones 1 and 2 are together. So I'm going to zoom in on that a little bit, and I can show you how to do that here, which is back over to our toolbar here. This little button here that looks like a magnifying glass. I'm going to click on that. And different proprietary MRI manufacturers will have different software, but they have some similarities in this. So now as I press down and drag my mouse forward, if you can see that, I'm basically zooming in closer. If I drag my mouse backwards, I'm zooming out farther. So I'm going to zoom in on the coccyx area, but you can see from having zoomed, the tailbone is actually off the screen. Come back here and click this little hand button, which says pan. By clicking that, the hand you can think of as, like if you were to move or shift the image around. So again, clicking with my mouse, moving this up, and immediately, if you didn't notice it already, this is a patient with a substantial dislocation at the tailbone. So we said that this was the fifth sacral bone. Here is here's the joint space rather between the sacrum and coccyx, which is then called the sacrococcygeal joint. Here's coccyx bone number 1, and then coccyx bone number 2 and 3 are actually fused together in this case. So the most notable finding here is that there is a complete dislocation between coccyx bone number 1 and coccyx bone number 2, so at that C1-2 joint space. Normally you would expect one level to be lined up on top of the other, so you can see this first bone of the coccyx is lined up just immediately below that fifth bone of the sacrum. You can see that alignment here. If you drew a line sort of with your mind's eye along this back wall of the coccyx here and sacrum here, or the front wall here, just like if you were stacking bricks, the tall way one on top of the other, these are nicely lined up. And then here you can see where that dislocation has occurred. So that next bone of the coccyx should be down here where my thumb is, but instead it has shifted or slid backwards. The medical term for this is listhesis, which just means sliding. So just like you could slide a drawer open or closed, you could slide a bone in or out from a joint space if that joint space is unstable. So this would be a joint where, just by the appearance here, we know that there must have been disruption or tearing, instability of the ligaments that normally would have held that bone into its normal position right underneath the bone above it. And then just like you could decide, well, is a drawer slid 50% open or 100% open, etc. Similarly here we look at how far is it slid out from its normal position under the bone above it. In this case it's essentially 100%, because if you look here along the back wall of the first bone, and drew your line down with your mind's eye, essentially none of the second bone is underneath the first bone. So that's a 100% dislocation. This particular patient does also have a small bone spur down here on the lower part of the coccyx. So there is that going on as well, where there's a thickening in the of the lower part of the tailbone, heading back behind the patient, just to sort of orient you again. This is the patient is oriented kind of this way, where to the left of your screen, as you're looking at this, is the is inside of the patient, and to the right is behind or outside of the patient. So this would be a patient who had a dislocation here. There's other images that we can go through, but on this one I really just wanted to focus mainly on that sagittal image showing the complete dislocation at that site. Typical MRI, if it's not ordered in the proper way, if it's not ordered in a way that includes the midline sagittal images with thin slices, if it's not ordered properly and done properly, it may not include the tailbone at all, or it would include it but not give you the kind of helpful information that you need. And this is just showing the same type of thing that we're talking about with the dislocation. This is just a medical illustration of a coccyx dislocation. Just an illustration from actually from my book on tailbone pain. But this is talking about cases where there's instability, where some patients will have a normal appearance of the tailbone while they are standing, but have a substantial dislocation while they are sitting down. So in those cases, the x-rays done while they're sitting down can detect that. By the way, I will point out that in this particular illustration, it's at that same joint that we just looked at in that patient's MRI, so just by coincidence. So here's that first bone of the coccyx up top, and then the second bone here, and that dislocation in between them. So right at that location, where you can see there's no overlap between this bone and the one below it. And that's just from one of the chapters within the book. And this is an illustration showing the bone spur. which is that area of bone that extends kind of down to a point down here below. So those were the main two things that I wanted to to point out on that patient's MRI, so you can see that and put that into some perspective. If you want more information about tailbone pain, certainly you can go to my website, which is tailbonedoctor.com. If you're interested, if you'd like a copy of the book, Tailbone Pain Relief Now, you can get that on Amazon, within the United States at least. I know it's on Amazon. At the time that I'm making this video, actually you can also get a copy for free going to the website www.tailbonepainbook.com. So you can get that there as well. It's basically 272 pages, all about the tailbone, so that and it reviews everything from causes of tailbone pain to testing, X-rays, MRI, CT scans, the appropriate treatment, from medications to cushions to various injections to surgery. I hopefully have considered included just about everything in there, at least at some point, to at least give you an overview. So if you're suffering from tailbone pain, or someone you know is suffering from tailbone pain, certainly feel free to grab a free copy of the book. You just pay for shipping and handling or whatever, or get it on Amazon if that's more convenient for you. Or if you want to come to see me, I'm at www.tailbonedoctor.com, and would be happy to do what I can to get you some answers, and of course, more importantly, some relief. So that's all for now. I hope this was helpful for you, just in reviewing about MRI at the tailbone. Bye-bye.